Welcome, everyone. I'm Audrey Vernick, the Director of Patient and Family Advocacy at the Pediatric Epilepsy Surgery Alliance and a parent. My own son had a right hemispherectomy at age 2, and he's now a young adult. I know firsthand that transition does not happen all at once. It's a series of small steps, and this session is about helping you take practical ones towards adult health, whether you're a teen, a young adult, or a parent figuring it all out. This Power Hour is made possible thanks to support from UCB, one of our trusted partners in the epilepsy community, and we're very grateful for their support. What we'll cover today is what healthcare transition actually means, the skills teens can start practicing right now, seizure safety in adulthood, in college, work, and life, legal changes at 18, tools to support real-world independence, and you don't have to do everything today. But starting now means your teen will be more prepared and less overwhelmed later, which means you will too. So let's talk about the definition of healthcare transition. This is more than switching to an adult neurologist or primary care doctor. It means that they understand their condition, they can manage their own medications and appointments, they know what to do in an emergency, they can communicate with their doctors, and they can navigate insurance and healthcare systems. It also includes managing their own reproductive health, mental health, social well-being, being aware of things like substance abuse and alcohol use with seizure medications, all of that. So when we think about what pediatric care is, it is a coordinated and family-focused system. So we've all had frustrations with the healthcare system, but in reality, pediatric care is the dream world. Adult care is more fragmented. It is the reality world. Support is limited, and patients are expected to manage it all, even without a care coordinator. And that is a huge shift. It's important to note that the transition of care is not the same as the transfer of care. So in a typical transfer, the pediatric doctor refers the patient to an adult provider, sends a summary letter, and says goodbye to the patient. That's a one and done situation. Transition is a multi-step process. It comes before, during, and after handoff. It should include planning, transfer, and integration into adult care. And transfer doesn't mark the end of transition planning. Even after the handoff, many young adults may need ongoing support as they adjust to their life as managing their own health care. Teens will need time to practice managing their care, and it's best to start this well before they turn 18. As a matter of fact, the leading resource in transition to adult healthcare, which is Got Transition, which will be on our resource slide at the end, recommends that transition of care starts at age 12. So really starting as early as possible. If you haven't started and your child is already 20, don't worry, you can still do all these things, but we want to really have this start as early as possible. A strong transition of care plan is gradual and developmentally appropriate for the young person. So some might be more independent, some may require more supports. It's patient-centered. So we're really thinking about what does that individual patient need. And it's inclusive of caregivers because while your role will lessen, it's not going to go away completely. So let's do a little case study just to set this up so you understand this in a sort of a real world application. So this is Anna. She's 17 years old. She had epilepsy surgery when she was younger. She's seizure free on medication and she's heading to college next year. From the outside, Anna seems totally ready, but her parents still manage all of her prescriptions. She's often sleep deprived because she stays up late managing her school workload, and we know that lack of sleep can be a trigger for seizures. She plans to move out of state, but she hasn't found an adult provider. She hasn't transferred her medical records. She has not set up a seizure action plan for her college environment. No one at her college knows about her epilepsy. And she hasn't registered with the college's disability office. So she's medically stable, but she's not transition ready. And even capable teens need support to lead their care. If your teen has an IEP or a 504 plan, you are probably familiar with school meetings and accommodations, but what's often missing, especially for students with complex medical needs, is a clear plan for managing their health as part of their transition to adulthood. This is where school nurses and IEP teams can play a crucial role. Under the Individuals with Disabilities in Education Act, or IDEA, By age 16 or earlier in some states, the IEP must include measurable post-secondary goals in three areas: education or training, employment, and independent living. That third area, independent living, that's where healthcare transition fits in. After all, if a student can't manage medications, communicate with doctors, or recognize health emergencies, they're not truly prepared to live independently. Schools are in a unique position to help. Nurses and special education staff can assess your child's transition readiness, teach them health related skills, and support both the student and the family through the process. Even for students with a 504 plan, which doesn't require explicit goals, school nurses or counselors can still guide families toward transition tools like checklists, apps, and planning resources. Finally, schools can help prepare teens and families for the legal changes at 18 when students take on responsibility for their own medical decisions. Health literacy does not just mean being able to read a medication label. It means knowing how to understand, use, and act on health information in everyday life. That includes everything from following instructions, using patient portals and pharmacy apps, and judging if information is trustworthy. Teens with epilepsy or other neurological conditions need these skills for independence, and teens who have added learning or cognitive challenges may require additional supports like visual guides, repetition, and lots of practice. In the research, it shows that low health literacy leads to worse outcomes in healthcare. But the good news is these are teachable skills, just like all the other skills we've taught our kids, right? So, how do we assess where our student is starting? The school nurse and IEP team can be of critical importance when helping determine the student's health literacy level. It's not just about what they know, it's about whether they can apply that knowledge in real life situations. So, some things to think about would be to ask your teen, what do you take this medication for? Or what would you do if you missed a dose? Or how would you know if you were having a seizure again? These questions can reveal what they know and what still needs to be taught. There are also many formal tools that either you or the school team can use, and we'll share those in the resource document. So, developing a self-care plan. A self-care plan is a document that helps teens manage their daily health needs and prepare for emergencies. It is one of the best ways to build both safety and confidence before they transition to managing their own healthcare as adults. It doesn't have to be fancy. It can be a phone note, a Google Doc, or a printed sheet. The point is, it should be portable, in their own words, and accessible when they need it. Many of our teens and young adults who've had epilepsy or epilepsy surgery are still relying on us to communicate for them with their doctors, schools, and in emergencies. But in adult life, they will be expected to explain their health needs, whether it's to a professor, an employer, a roommate, or the school health center. Having a plan like this in hand reduces anxiety and it makes unfamiliar situations like a new doctor's visit less overwhelming. It gives them a roadmap, and it's also going to allow them to talk about and practice some of these different scenarios beforehand. So, some key elements of a self care plan include a summary of the condition. And this needs to be in their own words, not medical jargon. So, for example, you would say, I had epilepsy surgery when I was 3. I haven't had seizures in a few years, but I take daily medication to prevent them. We don't want to have a lot of clinical language. We want it to really be student centered and student focused, or child centered and child focused. A list of their medications, what they take, why, doses, how they can refill them, all of that. Do they know their triggers and warning signs? Those should be spelled out. What are the steps to take in an emergency? Are there specific phrases or requests they have around how information is shared with them? So there's self-advocacy around, I prefer written information, or could you please speak more slowly, that sort of thing. Mental health supports. So if they see a therapist or take medication for anxiety or depression, that should be in this self-care plan. And they should also have some strategies in there. What helps me when I'm overwhelmed? So that could be part of the self-care plan as well. And then disclosure preferences. So this is often the most challenging part of the transition. Teens and young adults often struggle with how and when to talk with others about their condition. So do they want to let their roommates know in advance? Do they want to tell their professors about their condition? They don't have to, but they might want to. What about an employer, right? So if they want accommodations in school or work, they will have to. So how are they going to do this? This plan helps them think this through before they're in a stressful or high stakes situation. You can absolutely help your young person build this plan, but let them take the lead as much as they're able. The more ownership they have, the more likely they're to remember and use it. And if your teen can't fill in some of these pieces yet, that's okay. That tells you exactly what still needs to be taught or practiced. For children who have more severe disabilities as well, this would be a tool for you as a family to understand the missing gaps as well. So, for teens and young adults with epilepsy or a history of epilepsy, knowing what to do in emergency is not optional, it's critical. And emergency planning is not just about safety, it's also about confidence, independence, and peace of mind. Again, the teen or young adult should be actively involved in creating their own plan. That's part of the transition process. They need to understand when to ask for help, who to call, and what to say. So, where do you start? Here are a few guiding questions. You can ask your teen or young adult, what counts as an emergency to you? Is it missing a dose of your epilepsy medication? Is it a new symptom? What symptom? A known seizure trigger? When would you call 911? And when would you call urgent care or maybe just call your doctor's office? Who do you contact in different situations? So would you need to call me, your parent? Or you have a friend that you would call? Do you have a neurologist that you'd be emailing, or would you be going to the college health center? Every student with epilepsy, or I would argue a history of epilepsy and epilepsy surgery, needs a seizure action plan. And that should be shared proactively with roommates, staff, and any others that you feel would need to know this information. And again, asking your teen, do you know where your rescue medications are? Would you feel comfortable teaching someone else how to use them? And what symptoms would you bring up to a roommate or a classmate or a teacher if you had them in the moment? These aren't easy questions, but they can be empowering. And here's the reality, and I have lived this. Once these students get to college, many stop turning to adults for help. So they're turning to their peers or more often the internet for advice. So while they're still in high school and while you still have regular contact with them, use that time. You'll also want to think ahead about some things if your child is still actively having seizures or using seizure medications. Will they need a seizure alert device or other monitoring tools? Will the dorm staff or apartment managers need any training? Note that some dorms don't allow controlled substances to be just in the child's dorm room or the student's dorm room. So they would have to make arrangements for a special lockbox, a special setup, and then that might make the medication not available or accessible. So really thinking about that. And then who's going to track patterns or changes in this young person? Is it a phone call to a parent every week? Is a doctor going to have regular check-ins, a school nurse? So remember, you're not going to have eyes on your young adult once they're no longer living with you. So thinking about these things is really important. I did not know or realize that my son was going to live away from us. I assumed he would need a lot more support, but he has lived away from us for the past few years. So even if you don't expect it, planning for this can be really helpful. And even seizure-free teens need a plan. So symptoms can return due to the stress, sleep disruption, missed medication doses, and other things that can happen at college. Use of alcohol and recreational drugs, all of that. And then again, for families whose children might not be on a path to full independence, you might be thinking, do we really need all this? And again, I would say yes, because emergency preparedness is not just about full independence, it's about dignity and voice. Every young person deserves to have a plan, no matter how much support they need. And when you include them in the process, you're sending a powerful message. You're saying, you matter, your safety matters, and your voice matters. So finding a way to include them is really essential. So I talked a little bit about the role of the IEP team, and you can use the IEP to write goals that would be related to the young person's health transition. So first we would think about a post-secondary goal. Post-secondary goals are long-term goals of what the student will do after high school. So for example, it might be as broad as the student will manage their medical condition independently. And so now we would ask, what do they have to do in this year to move them toward that goal? And so that's a really broad, what aspect of their medical condition are they managing independently? So there might be 10 annual goals that will support how they would be working towards that post-secondary goal. The and one example might be the student will create and maintain a written self-care plan and an emergency plan. Another goal might be the student will recognize when they're slipping into depression or showing patterns of anxiety and have a plan of who to reach out for, an emergency backup plan, that sort of thing. And then we can get even more specific with benchmarks. These are the small actionable steps the students will take. For example, refilling a prescription or sharing that plan that they wrote with staff. Some states only require benchmarks for students with significant needs, but I recommend including them for everyone. They keep the goal grounded in real life. And here's something I want to emphasize. Transition planning should be integrated into the IEP, not just an add-on. So transition planning should be the foundation of the entire IEP. So if you have a young person who's 14 or 16 years old, whatever age your state requires transition planning to begin, that should be the framework of the entire IEP. The question we should be asking at this age isn't just what are your academic goals, but where is the student headed? What kind of life do they want? And what skills do they need to live that life well? And that's where real world readiness begins. And for students with epilepsy surgery, or chronic conditions, managing their health is a non negotiable part of that readiness. And a few final tips here is always use plain language and goals as well. Everyone should understand what is being worked on, include the supports the student will need in the goal. So if it's a goal that will be met with visual reminders, make sure that's part of the goal, or role play or whatnot. And remember that progress can be gradual, and that's okay. The goal is to build a lifelong skill, not to check a box. So we want to be working towards something, but we don't expect it to be finished immediately, or we wouldn't need a goal for it, right? Let's talk about something else that often makes or breaks a young person's successful transition to adult healthcare and adult life, really, is medical self-advocacy. Because no matter how brilliant your teen is, no matter how good their doctors are, none of it matters if they can't speak up for themselves, manage basic tasks, or ask for help when they need it. So again, the reality is, when students move into the adult world, many of the supports they've relied on will disappear, both in their healthcare settings and in other aspects of their life. There's no nurse walking into the classroom with a reminder, hey, it's time to take your medication. No one's calling you to schedule a missed appointment. There's the new provider that your young person is seeing may not know anything about pediatric epilepsy surgery or your child's surgical history. Their insurance can change, especially if they move out of state, and prior authorizations may be required for medication, for example. I've seen this happen where a month into school, I hear this every year. Someone's on one of the Facebook groups talking about how their student can't get access to their medication. The responsibility for all of this falls squarely on their shoulders. And unless they have practiced how to handle these situations, it can be really overwhelming. So we have to ask, what can they learn and practice now before they graduate? They can start small. So some things you can do is role play conversations with them, help them set medication reminders, help them write down questions before every doctor's visit, and maybe practice asking you those questions. And then if your child is going out of state, you really want to think about continuing. How is care going to be continued? Many neurologists, most medical providers in the US can't provide out-of-state care virtually across state lines. And we can't wait to have an emergency until they're home on break. So probably establishing care in whatever state the young person is going to be in is going to be important. So you want to make sure you're researching providers near campus, getting some referrals. This might take a little while. So really thinking ahead, making sure that care is established before there's a crisis. So not just getting a name and them saying, oh yeah, I'll call them if I need something. No, they have to go in and establish care so that they can then call the office or message the doctor and say, this is the symptom I'm having, or I'm going to the emergency room. Will you meet me there? And make sure they know how to transfer their medical records, or have them bring a medical summary of their medical history. You won't be there to do all of this for them, maybe, right? So they might be living at home with you, they might be in a supported program, but you can help them do it with support now so they can do it independently later. And again, for students with disabilities or cognitive differences, self-advocacy still matters. They can learn to express their needs and use supports regardless of their disability. So back to Anna. Anna's seizures are controlled, but her self-management isn't. And that's where the risk lies. So before graduation, I would recommend for Anna that she focus on 4 areas: her self-care plan, her medication management, emergency planning, and communication. These will all help her build safety and independence before she leaves to go out of state for college. And we know that college adds new stressors as well. So there's going to be issues with sleep, there's going to be issues with stress, and then making sure they understand where to get the supports they need. In their self-care plan, I'm going to just mention here that mental health matters. Anxiety and depression are common among many young adults with epilepsy, and both can worsen seizure control. And we know that anxiety and depression are very high in college students as well. So those are risk factors to be aware of. So before graduation, I would have Anna connect with a therapist, ideally someone who understands epilepsy and her medications or her history or is willing to learn. And again, college adds those new variables, alcohol, irregular sleep, etc. So discuss these openly and help her establish clear boundaries. And even talking about things like birth control and seizure medications, right? Don't be afraid to start having these conversations because you don't want this reality to hit her when she's away from home. Medication management, we've talked a little bit about the emergency protocol we discussed. For communication and self-advocacy, Anna has to be ready to explain her needs. She has to be ready to register with the disability office at her school, and she has to be able to ask for support clearly and confidently in many settings. Because in adulthood, accommodations are not given to you, they have to be requested over and over and over again. So personally, I cannot understate this or overstate this enough based on my own son's experience. This is the key thing, is that they are comfortable over and over again saying, this is what I need and this is why I need it, and not taking no for an answer. So your school nurse, the child's school nurse, can be one of your best allies in preparing your teen for adult health care. They can start conversations with them about medical independence. They can help assess how ready your teen is, and they can suggest IEP or 504 supports that make sense. They can coordinate with other healthcare providers, teachers, other service providers on the IEP. They're often the first ones to notice gaps in independence because they work so closely with your students. And even if they don't, you can ask them to walk through a readiness assessment checklist with your team. So I've presented twice at the National Association of School Nurses on this topic. One of the resources I'm going to share with you is the school guide for school nurses, and that can help you. You could share that with the school nurse and they can understand that students with epilepsy need extra support in this setting. So let's talk about some of the common barriers that families face when trying to prepare for healthcare transition. So let's say you walk into your child's IEP meeting or your teen's IEP meeting ready to talk about medical self-management or seizure planning, and someone says, that's medical, that doesn't belong in the IEP. So here's the truth. Health is education. It affects attendance, energy, focus, safety, and the student's ability to function throughout the day. And under IDEA, transition planning is required for any area that affects a student's success after high school, including healthcare. Remember, that would fall in that independent living bucket. So learning how to manage a condition is part of becoming an independent adult. So if the school team refuses to address it, the student may leave high school unprepared. So pushing for that is really important, and help educate them. Using that NASN toolkit that I mentioned can be a great way to start this conversation. On the family side, actually the research shows that the #1 barrier to a successful transition to adult healthcare is the family. There's a feeling of they're just not ready. And I get it. You're thinking about what happens at 18, signing legal forms, making big decisions, managing medications on their own. It can be overwhelming. So here's the approach I recommend. Start small, one conversation, one skill, one goal. What can they do today with a little support? And then build from there. It's not about doing it all at once. And anytime we have anything like this, that's the Hydra, the many-headed beast, I always say it's one bite at a time, right? You can't do this all at once. And of course, sometimes the resistance comes from the students. Maybe they roll their eyes and say, why does this matter? Or whatever, I don't need that. And this is where we shift the conversation. We have to find their motivation, the hook. What do they want? If they want to drive to prom next spring, maybe you're asking what would happen if you had a seizure on the way. Let's make a plan together. Or what if you had a seizure at the prom? Make it real, make it about their life, and have them take ownership of it. That's where they're going to be motivated to work on it. And finally, sometimes the barrier is time. You might think, I don't have time to add one more thing. The reality is you're already helping your teen grow, and health transition fits right into all the things you're already doing. And every little step you take, every conversation, every skill you practice helps build a safer and more confident future for your teen. So I'm going to talk a little bit about what changes when your child turns 18, because at 18, your child becomes a legal adult, even if they still rely on you for care, and even if they're cognitively not an adult. Legally at 18, they become adults. And that shift brings real legal and medical consequences. So under FERPA, the Federal Education Rights and Privacy Act, the student, not the parent, now controls access to their educational records, including their IEP. So both in high school and in college, they will have FERPA at age 18. They're going to transition to being their own educational rights holder. Some states may allow parental involvement in the IEP process until high school graduation, but many do not. And some colleges, even if the student starts at age 17, starts those protections right as soon as the student is ready for college, they feel they're ready to manage their own educational records. So unless you have a specific educational release form allowing you to communicate with the IEP team or their college team or view records, you will not have access to those. And then under HIPAA, which is the Health Privacy Act, the same thing happens with medical records. Even if your child has epilepsy and intellectual disability or is currently hospitalized, you may not be able to access any of their medical information unless you have written permission or there's legal paperwork in place making you legal guardian or conservator. And I'll be honest, this surprises parents every time. I've supported families when a young adult had landed in the ER and the parent was told, you don't have the right to make medical decisions. And they had to scramble to try to figure this out. So, how can you prepare for this? Start early, well before age 18 if you can, and explore all the legal options so you can understand what those options might be. I'll pause here and look at the chat. I do have a copy of the assessment, and then I will talk about FERPA and the educational release form in a minute, as that was in the chat. All right. So you're going to start by exploring some legal tools like the medical power of attorney, so you can still speak to doctors, an advanced healthcare directive, and the educational release forms. So you can go on their 18th birthday to your local notary with these three forms that you can find online, and they are also in our transition course and guide, and just have the teen sign them and have them notarized. And then you would have notarized forms. And for their power of attorney, you can cover all the powers, not just medical. So that is one thing to do at age 18 if they are competent decision makers. But if your child is 18 and they're not actually competent to make their own decisions and they sign those forms and you get into a legal or medical situation, a judge might say, well, they weren't actually competent to sign that form and you should have had guardianship or conservatorship. And then they can be in this legal limbo. And I've seen that happen as well. If you think your child might need a higher level of support, thinking about guardianship or conservatorship or supported decision making is really essential. But one thing I will say about tools like supported decision making, some hospitals will not honor anything that is not stamped by a court. So if it's not a legal court document, supported decision making, even a power of attorney might not be sufficient. They will argue that unless you're the guardian of the person, you can't access their medical records or even go into the hospital with them in some cases. Even if you've done everything right, you might still face barriers. So this is why it's important to plan ahead and ask questions before there's a crisis. We also need to help students understand, help our young people understand, what does it mean to have control over their own information? So your young person should learn when, how, and why to disclose their condition. Because like I said, college professors, employers, landlords, they're not required to offer help unless the student asks for it and discloses their condition in some cases. So, and students may not know how to do this or feel nervous doing it. So you can role play with them, write scripts, and help them build their confidence in this over time and really talk through what they would disclose to who, how much, what's the least amount they can disclose, etc. So let's wrap up with a few key takeaways and then we'll have time for some questions. Health transition is part of independent living. That means it belongs in an IEP, in the classroom, at home, and in daily life. Learning to manage a condition isn't separate from education. It's not separate from the rest of their lives. It's part of being prepared for adulthood. And this is really crucial. So just be pushy on this front and make sure that you're really thinking this through both with the child's educational team and their medical team. Small steps do matter. So whether it's your teen asking questions at the doctor's office, using their own pill box, or learning how to use their patient portal to access records, every step they do on their own or even with a little support can help them build confidence and skills. Students who have these chronic conditions and cognitive issues as well and other disabilities, they need time and support. And for any child, any young adult, these are not skills that magically appear at age 18 either. So without guidance, many students leave high school without knowing how to refill a prescription or how to speak up in a medical setting. Starting early is key. By 10th or 11th grade, ideally, our teens need time to practice and they may resist, forget, or get overwhelmed, and that's normal. What matters is repetition, coaching, and support. And so again, don't panic if your child is already 20 or my son is 21 and we are still working through everything that I talked about today. There's not a deadline for learning these things. There is continued ongoing practice. And I think you've probably all heard me say extend the runway. So our young people might need more support, and that's okay. Teens need a health advocate. There's a paper I'm sharing in the references by Okumura. She's actually my son's primary care provider, which I thought was kind of cool when I was researching for today's talk. And they talk about how teens with chronic health conditions need a health advocate because there is no care coordinator, there's no patient, there's no primary care coordinator generally in adult care. Everything's very siloed. Sometimes that will be the parent or ongoing. Sometimes a provider will take on a care coordinator role if you're lucky. And then sometimes the young person themselves has to become their own health advocate. So teaching them those skills again as early as possible can help them master that. You don't have to do everything all at once. Just begin one small step at a time, starting now. And that means less stress later and a stronger launch into adulthood. So here are a number of resources. Pretty much everything I talked about can be found in one of these resource documents. I will share the slide deck with all of you after today's session. Some key things would be looking at our Educational Transition for Youth with Neurological Conditions guide and, let me go back, and our Transition Roadmap for Youth with Neurological Conditions course. So in the course itself, if you sign up for that, are downloadable documents of everything we talked about today. It's all in there. So if you're looking for it, and there's even, if you go to the very last module, there's a button that says download all the documents from this course, and they're all there. I think they still are, so I'll double check as soon as we're done today. And there's a number of other great resources here as well. The Transition to Adulthood checklist is also something we created with the Rare Epilepsy Network, and it gives you step-by-step things to think about all along the way, starting from age 3 to age 24 and beyond. So that's another great resource. So take a look at all of those. The Supporting Students with Epilepsy, a Transition Toolkit for School Nurses. Again, another really useful tool and can be really helpful to bring to the school team if they're just not understanding what it is that you're asking in terms of getting the school more involved. And I'll give one other example here. My son has a visual field loss as a result of his stroke and hemispherectomy. And when he was going through his transition assessments and transition planning in maybe his junior year of high school, one of the things that we talked about in one of his IEP meetings was that he didn't really fully understand his visual impairments yet because he has multiple visual impairments. And the vision teacher took it on upon himself to meet with Bennett, I think it was once a month, to talk through his visual impairments and give him some self-advocacy skills. And this falls under self-advocacy. There's actually a specific code that is generally used for diabetes that's in the IEP planning for school nurses. And there's no reason why they can't apply that same code for a student who has epilepsy or a history of epilepsy surgery, any other neurological condition. So again, that transition toolkit by the National Association of School Nurses is a really helpful tool. That's this one, Supporting Students with Epilepsy, a Transition Toolkit for School Nurses. All right. And then here are some references that I mentioned today. One of my favorite transition experts is Danielle Andrade. There's a couple of papers here by her. And then again, I mentioned that paper by Dr. Okamura, who is talking about that role of health advocacy. And there's some other great resources here. There's a new paper that just came out, Navigating Transition to Adulthood in Epilepsy Patients, that I just found today. So take a look at that as well. So thank you so much. And I am going to open it up if anyone wants to unmute or in the chat, ask any questions, and I'm happy to take them.